Okay, your oxygen level is 99 and your heart rate is 66.
Stefan Lim is taking a walk test.
You just walk back and forth at a comfortable pace.
He recovered from COVID-19 over 2 months ago. But till today, he's still suffering from shortness of breath and heart cramps.
Over 1.2 million people in Singapore have gotten COVID-19, including me. And while I thankfully do not have any lingering symptoms, many like Stefan say they are still suffering.
A few days ago, I put out this message.
I've heard of some who had COVID almost 2 months ago and are still feeling breathless, tired, and like they have a bit of brain fog. If you're one of those people, we want to hear from you.
Within hours, I had over 50 replies. So I've brought together some experts to answer your questions.
Stefan, I'm going to start with you because just a short while ago we saw you taking the walking test to test your oxygen level. But before we give you your results, maybe you can tell us what makes you think you have long COVID?
Well, I actually recovered from COVID-19 in around the middle of February. And then after about a week or two, I started to develop new symptoms, breathlessness, chest pains, heart palpitations, as well as several gastrointestinal issues. It got to an extent where I was afraid I was having like a heart attack. So I've actually been to the A&E 4 times just to get checked out.
Okay.
And besides that, day-to-day living, I don't go out as much anymore. If I do go out, it's best to have someone with me.
Dr. Mania, you run Singapore's long COVID clinic. From the patients you're seeing, are the symptoms they describe similar to what Stefan is saying?
Yes, in many ways. It's complex. There's the most common symptoms that people describe, which is a loss of stamina, feeling more tired than usual. Brain fog is a common symptom that people describe, difficulty concentrating, and then sometimes palpitations or persistent cough or breathlessness. But really, it is a big mixture of different symptoms. And sometimes, I don't know how your time course has been, but sometimes people say that they didn't have them initially and they came on a couple of weeks later and can often be going through a waxing and waning pattern, so getting worse, getting better.
That was exactly what happened to me.
Was it?
Yeah,
Okay.
I actually recovered and I thought I was getting better, and then suddenly the new symptoms came out about a week or two afterwards. Yeah.
How many patients have come through your door since the clinic started?
So we started the clinic back in November last year, just before the Delta wave was peaking. Since the Omicron wave, we've had many more referrals, unfortunately.
We understand there's a bit of a wait list now as well.
In a way. So we have opened more clinics so that we can see people quicker. The standard definition for long COVID, which we followed from the UK, which is that long COVID is after 12 weeks from the acute infection. So that's when we try to see people.
And Dr. Young, I mean, when we did the walk test for Stefan, what exactly were you looking for?
We were looking for something that could point out why he was feeling all these symptoms of breathing difficulty or causing the palpitations. So when we do these dynamic testing, we are putting the patient a little bit under stress in what we call exercise conditions. We look at the oxygen level, whether there is a drop in terms of the oxygen saturation for the pulse oximeter. Anything more than 4 percentage points drop is significant, which means your lungs are not able to absorb oxygen, and that means something wrong with the lungs itself. Okay. Then we look at the heart rate, because if your heart rate increases dramatically at the end of exercise, it means your heart is at rest is fine, but under stress, your heart rate dramatically increases the heart rate to compensate for more blood flow. That could indicate a heart issue. Right. And then the last thing we measure is the distance that he walks in the 6 minutes.
Okay, so you better tell him the results. I think his heart is beating faster already.
His walk distance was a little bit lower as expected for someone of his age and with fitness, but his walk test was actually as expected for a person his age. His oxygen levels remained the same. It doesn't give us any objective data that shows something is wrong. So it looks all quite okay.
So Stefan, you've heard Dr. Young tell you that basically you're okay. Does that surprise you?
Not really. I did have several tests done, and preliminary they came back okay. The results are all here. So I've done the standard 12-lead ECG for the heart rhythm. I've done echocardiogram, Holter 24-hour monitoring. Those are for the cardiac aspects. Then for the lungs part, I've done a lung function test. I've also done a brain MRI for persistent headaches. Yeah, I've also done 2 scopes, a gastroscopy and a colonoscopy for my gastrointestinal issues.
I mean, it almost sounds like he's not quite sure what's wrong.
Yeah, it's a little bit difficult, and it does vary, obviously, from person to person and case to case. But I do think we need to be careful not to over-medicalise long COVID.
But at the same time, Stefan is saying it really has disrupted
Yes.
his life. He
Yeah.
wants to fix it and do something about it.
Plugging away through all these different tests may not be the best way of managing the condition. One of the problems that people were having before is that they're shunted from specialist to specialist because there's different symptoms which maybe are coming and going. And so different specialists may focus on one area and then pass on to another specialist if they don't find the exact cause and not able to pinpoint it. So what we try to do in the long COVID is have that sort of overview of everything that's happening so that you're not each time having to explain everything that's happened, trying to keep track of all the different tests and all the different symptoms that may have happened over the past couple of months.
How do we diagnose long COVID?
It's really a diagnosis of exclusion. So what we do in the clinic is we do a set of baseline investigations, some blood tests, a chest X-ray often, maybe an ECG. And then if those are normal, often we would not do any further investigations. This is what other people are experiencing as well. So this is not something unusual. You're not alone in what you're experiencing. And things will get better.
But
and
unfortunately,
it's a matter of time. But
you say it's a matter of time, and I think unfortunately for Stefan, I mean, you've heard this before, right? Because you've got the results, they've come back clean, and you've gone, well, then what? Does it frustrate you even more now?
I was fortunate or unfortunate to have some findings for my lungs and my heart, as well as a diagnosis for my gastric issues. So in that sense, I got started on a treatment plan, and it gave me a sort of assurance that at least something was being done.
But you had to search really hard for this. It took you many tests to finally have something to sort of fix.
That's right. It doesn't show up on the preliminary testing. It usually comes in those deeper specialist kind of testing.
When you started all these screening tests, I mean, if your full blood count or your X-ray is normal or your ECG is normal, you might not pick up certain complications post-COVID, which like pulmonary embolism, myocarditis. Some patients may have a heart attack, which is minor. So you might not pick these things up. So sometimes you have to dig deeper.
can I ask?
Yeah.
I'm just, because you said you had COVID.
I had COVID and I recovered fine.
Did you complete? I had COVID about a month and a half ago or so, at the end of March. And it has partially changed my perspective on long COVID in terms of what it is, I suppose. I recovered reasonably quickly within a week or so, but it's taken longer for me to go back to feeling completely as I was beforehand, I guess, and able to go back and do the exercise that I was doing before. Measuring my heart rate, my resting heart rate at night time was higher than usual when I'm out doing exercise.
Yeah, you know, the first time I went to play sports after recovering, I was a bit sluggish, but I figured I've just been sick, so give myself a few weeks and I should be back on track. And now it's 2 months later and I'm back to 100%.
Yeah, it's how it is for most people,
Right.
so it'll be a quicker recovery, whereas yours has obviously persisted now for a couple of months or so.
I also have ringing in my ears. After COVID, my back pain came back stronger and even more painful.
Notably is the headache that kind of lingers on from time to time.
And I've had several rounds of food poisoning when my friends and family will be eating the same food and they'll be okay.
Can these all be attributed to long COVID? Welcome back. We've been talking about what long COVID looks like. And in the week leading up to the show, we've been asking you to send in your questions about what you wonder about long COVID, you know, and we receive about 50 entries all within just one day. What's interesting is that unlike the usual long COVID symptoms we hear about, like brain fog and fatigue, people are also starting to report some other symptoms.
I also have ringing in my ears.
I have a back pain that recovered before COVID, and after COVID, my back pain came back stronger and even more painful.
Notably is the headache that kind of lingers on from time to time.
My stomach has just not been the same. I have constant bloating and discomfort, and I've had several rounds of food poisoning when my friends and family will be eating the same food and they'll be okay.
Can these all be attributed to long COVID?
They certainly can be. It's very, very difficult to be sure, but the range of symptoms are very wide with long COVID. So there may be those classic symptoms of tiredness and brain fog and and cough and breathlessness, but it really can be a range of different things that people describe, many different symptoms.
A lot of us would have heard about this idea of brain fog. At times, I find difficulty in choosing certain words to describe certain things. So, I just wonder, is it a matter of then really true? Or, it is just us, when we read something like that, there is a certain sense of confirmation bias.
So it is something that people have commonly described it. Further research is needed to really understand whether this is going to be a long-term problem, particularly with those studies that were reported recently describing the changes in the brain on the scans, which of course are very worrying for people to hear. And we don't know what it means really, and we need to find that out.
What was the worst day, if you can recall?
I would say when the chest tightness comes and it spreads all the way to the head, and then several symptoms flare up at the same time. So like the symptoms that many of the viewers mentioned, unfortunately I have accumulation of them.
Are certain age groups or gender more likely to get long COVID?
Why do some people have such bad symptoms like myself, and others can just feel fine and go about their life?
And how is it that people with, mild COVID symptoms also end up with long COVID?
Yeah, during the acute phase, the first week of my COVID infection, I just had the usual sore throat, the cough, a fever for a couple of days, and then it got better towards the end of the isolation period.
I can't answer the question to some extent because we don't really know what the exact trigger is. Something going wonky with the immune system is the most likely explanation.
The data has shown that if you are in the elderly age group, or you have a severe COVID infection, or you're unvaccinated, you will definitely have more long COVID symptoms. And at the same time, you've been in the ICU, you've been on the ventilator, and you've been on oxygen with a lot of scarring in your lungs, you will have a lot of long COVID symptoms. Is there an age group? Again, elderly, above 70, they have higher chance of having a severe illness compared to the younger patients. So these group of patients will also have more long COVID symptoms as well. I've read some reports, I think it's more common in some women rather than in men actually.
When we look at vaccine responses, actually, women's antibody responses are generally higher after vaccines. They're also women are at lower risk of getting severe COVID. So the immune system in females is better often. And this is not just with COVID, this is with many different infections. But perhaps because of that, there is this higher risk probably of long COVID afterwards because the immune system's reactivity is continuing after the infection has resolved.
Oh, interesting. I guess that's why women live so much longer, right?
It could well be.
Okay, we're going to talk a bit about children. Around 27,000 children between the ages of 5 and 11 were infected with COVID-19 between December and February just this year. Now, while most of their symptoms are mild, studies overseas have put the prevalence of long COVID among children anything from as low as 4 to 60%. Now, that is a really wide range. I want to know just how vulnerable our kids are to long COVID. So earlier on, I spoke to Dr. Lee Xiaohui from KK Women and Children's Hospital. So when we talk about this 4 to 60% prevalence rate, what does it actually mean?
So that means that in some studies, long COVID has been described in as few as 4 in 100 children.
Okay.
All the way up to 60 in 100 children. Well, most of these studies are done in America as well as in Europe. And they may not be entirely applicable to our Asian context.
Have you seen cases of long COVID among kids here?
So far, we have not had any children diagnosed with long COVID in KKH. That might be due to how we actually define long COVID.
Okay.
So in long COVID, children typically experience persistent or lingering symptoms after the initial COVID-19 infection. And these symptoms typically last for more than 2 months.
So it's more a definition thing. But I mean, it's very likely that some children would have come down with it, right?
Yes, and they might very well have symptoms that may be mild, so they don't present to the hospital. But they might otherwise be well enough to be attending school and not seek medical attention. So KKH is planning to embark on our own study to determine whether long COVID is a problem or not in the children and teenagers in Singapore.
Can long COVID affect a child's development if they have it?
Yes, Stephen. Potentially the symptoms that children experience from long COVID, such as difficulties in sleep, disturbances in their concentration and memory, might actually affect their learning and development. However, definitely we do need more studies to characterize these difficulties and symptoms.
Post-COVID, I feel like my muscles takes longer to recover compared to pre-COVID. My question is, should I self-medicate or should I just let it be and it will probably go away a few months later?
How long is long COVID? When will the symptoms actually disappear? Welcome back to our discussion on long COVID. I want to talk now about what I can do to manage my symptoms if I suspect that I have long COVID. For this segment, we're also joined by Dr. Wong Chin Jung, who has been rehabilitating long COVID patients. Dr. Wong, I'll start with you. What should people avoid doing when they experience symptoms of long COVID?
So in general, the advice is to do light intensity exercises and not to overexert. And that's easy to say, but it kind of varies from person to person as well.
Yeah, after the first week, I gave myself a week to recover after the infection, and then tried to go back to do exercises. I ran half the distance I used to run. Push-ups, I did half of what I used to be able to do.
And I would say that's a very reasonable approach for most people, because that's how they have been managing all their lives. However, we must recognize that in this condition here, it's not necessarily the same way the body might respond. So, for example, instead of jogging or running, maybe start with walks first and gradually increase them in intensity or even duration.
So in other words, I'm making things worse by trying to do the same exercise I used to do.
Exactly. So I think what people need to recognize is that there is a period of time where the body doesn't respond in a normal manner. Doing more does not necessarily equate to significant improvements.
In my case, because I do have some diagnosis, so at least there is some guidance as to the next steps that I should take when I could possibly start to resume certain exercises and such. But for the average Singaporean who may not have undertaken all these consultations, and besides self-monitoring, is there something objective that they can look at perhaps before they exercise, when they exercise?
So if you chart yourself carefully in terms of the activities you're doing today, doing tomorrow, and then with regular breaks in between, you probably will see there is improvement over time. So is there some parameter you look for before you start the exercise? It's up to the individual. If you feel you can try, so if you get over the fear factor, then you push yourself a little bit more, but also know your limits. If something's not right, you should stop.
How much of this is mind over matter, Dr. Bani?
I don't know. That's a very, very difficult area to think about. The symptoms are real. I mean, we're not sort of saying that these symptoms don't exist, but if you expect that maybe the first couple of weeks you need to take a step back and let it take its course, that you may possibly have symptoms that go on for even longer than that.
Right.
Then knowing that and expecting that, and I guess accepting it as well, not getting anxious or depressed or upset about what's going on, which is very difficult when it's so frustrating. But I think accepting that can help you to then chart your sort of recovery and help you to engage with your exercise and your rehab to then get back to how you were.
I feel like my muscles takes longer to recover compared to pre-COVID. My question is, should I self-medicate or should I just let it be and it will probably go away a few months later?
Even without COVID, just resting at home for 1 month, most people will undergo deconditioning. There will be an element of heart rate not being so good, muscles deteriorating. Okay, so what long COVID does is it hinders the ability to tackle the deconditioning aspect.
Okay, so in a way, it's sort of getting the engine warmed up, but just in a slower, more gentle process. Let's also talk about some treatment options, because there are now some antiviral drugs such as Pfizer's Paxlovid, which claim to treat long COVID. How soon do you think Singapore will be able to treat long COVID?
I think the chance that Paxlovid would help, for example, in your case now, is very low because it's not being driven by the virus anymore. It's probably being driven by the immune system. But finding something which can modulate the immune system without suppressing it, without overstimulating it, so you need to modulate it in the right way, is going to be very challenging and is going to take a long time. So yeah, I think don't self-medicate, and unfortunately don't expect there to be a good treatment soon.
Give people some idea of a timeline.
So there's some trials going on. So there's, for example, in the UK, there's a study looking at some using statins, so cholesterol medication, because they're known to modulate the immune system. Also, a trial looking at blood thinning agents, whether that may help, because there's, for some people, some types of long COVID may be due to microthrombi, so tiny blood clots in different organs. I think we may get some options, say, within the next year or so, but I don't think we'll get anything before then. And it may be that these agents actually turn out to not be effective.
One last question. How long is long COVID? When will the symptoms actually disappear?
Unfortunately, for some people, long COVID may really be a long thing. That may happen for some people. It's very uncommon. I will say I've seen a few patients in the long COVID clinic who've had symptoms that have gone on for more than a year and which have a different pattern actually from long COVID. Where they're waxing and waning over such a long period, and post-exertional malaise is quite a prominent symptom for this. We could be talking about this next year, in 2 years' time. I mean, it could be something that drags on for that long, for a small number of people.
Well, thank you so much for coming and then sharing your insights and speaking with us, and Stefan for sharing your story with us. So long COVID can be debilitating, but to date there's no proven cure, and it's impossible for now to know just what the long-term effects of long COVID really are. So if you've developed, new or any worse symptoms, do visit your own doctor, your primary doctor, your general practitioner. They are in the best position to assess you and will refer you to the necessary specialists. On that note, that's it for Talking Point. I'll see you next time. Bye.